This is CGTN, China Global Television Network.
The COVID-19 pandemic is reported to have largely affected frontline healthcare workers, the elderly, the disabled, women and girls, as well as minorities. That's according to the UN's Secretary General Antonio Guterres, who says poverty and destruction of the environment have also helped spread the virus. And in Tunisia, health authorities there say the COVID-19 pandemic has particularly taken a mental and emotional toll on senior citizens. Aden Shuashi reports.
The COVID-19 Task Force and the National Observatory for New and Emerging Diseases has urged Tunisian families to take care of elderly people who face a higher risk of contracting the coronavirus.
The most dynamic, active and healthy population must be careful in dealing with the elderly and vulnerable population by respecting social distancing and the prevention measures to avoid a surge in infections among them. The elderly people are physically and mentally fragile. Protecting senior citizens is the responsibility of the state and the society.
Neji Jlassi spends several hours a day on social media. This is how he's been connecting with the outside world during the general lockdown, as well as the self-imposed health confinement.
I'm terrified since the first wave of the coronavirus. I've not seen my 4 daughters and their children for several months because they think they could infect me with the deadly virus. It's hard to be away from one's family. Old people are fragile and isolated. I'm lucky to have my family, even if we can't meet face to face.
The 62-year-old retired civil servant says that social isolation and mobility restrictions have led to the boredom and loneliness.
Now I live with my wife and son. My son is always in his room to observe social distancing. We use hand sanitizers and face masks throughout the day. My wife looks disturbed when I cough and says that I'm coronavirus positive. It's mentally and psychologically disturbing and very boring. The situation is difficult.
According to a recent study by Tunisian researchers, social disconnection and loneliness were linked with depression and anxiety. In fact, health authorities have reported a rise in depression and anxiety symptoms among elderly people this year. According to the Ministry of Women, Family and the Elderly, 5 cases of coronavirus deaths were recorded in centers for the elderly and nursing homes during the second wave of the pandemic. Experts say the number of fatalities remains high among senior citizens. Adnan Shawishi, CGTN, Tunis.